Ladies and gentlemen, good morning. I'm La Yaxin from the Department of Endocrinology and Metabolism, the first affiliated hospital of China Medical University. Today we are going to learn diagnosis and treatment of dyslipidemia. First, let's come to the diagnosis of dyslipidemia. You can see this is the optimal level for cholesterol. It is below 5.18. For LDL cholesterol, it is below 3.37. And for HDL cholesterol, it is above 1.04. And for triglyceride, the optimal level is below 1.76. And this is the borderline elevated for total cholesterol, low-density lipoprotein cholesterol, and high-density lipoprotein cholesterol, and triglyceride. For elevated and decreased for high-density lipocholesterol, because we all know high-density lipoprotein cholesterol, it is the good cholesterol. So if it is below 1.004, it means this patient is suffering from dyslipidemia. And we have 6 types of dyslipidemia. For example, type 1, it is very rare, and this is the characteristic for the total cholesterol, triglyceride, chylomicron, VLDL, and low-density lipoprotein. And in this type of dyslipidemia, it can cause pancreatitis. For type 2A, it is very common. The plasma appearance is clear, and it can cause coronary heart disease. And for type 2B, it is also very common, and the plasma appearance is very clear. It can also cause coronary heart disease. For type 3, it is rare, and from the plasma appearance, it is cloudy. You can see the triglyceride is very high. It can cause coronary heart disease. And for type 4 dyslipidemia, the plasma appearance is milky, and it can cause coronary heart disease. And for type 5, it is very rare. The plasma appearance is creamy or milky, and it can cause pancreatitis. How to treat dyslipidemia? The principle of treatment include prevent atherosclerosis, reduce cardiovascular event, reduce the risk of diabetes and metabolic syndrome, reduce the mortality rate. So our first aim is to lower low-density lipoprotein cholesterol. For example, if the no hypertension and other risk factor lower 3 and low risk, and this is the moderate risk and high risk. So from this table, you can see the risk level and how to start our drug therapy. You can see for low risk level, if the total cholesterol is over 6.99 or low density lipoprotein cholesterol level is over 4.92, we can start drug therapy, and this is the goal. And for moderate one, total cholesterol is over 6.21, low density lipoprotein cholesterol is over 4.14. And for patients with high risk, the total cholesterol is over 4.14 or low density lipoprotein is over 2.6, we should start drug therapy. And for very high risk, the total cholesterol level is over 4.14 or the low density lipoprotein level is over 2.07, we should start drug therapy. Treatment include lifestyle change such as diet, weight control, and do more exercise, correct bad way of life, for example, quit smoking, alcohol limitation, salt limitation. And others, for example, operation or blood purification. And the most common method we use for the treatment of dyslipidemia is the drug therapy. And let's see the drug therapy. The first drug, HMD CoA reductase inhibitors, statins. Statins such as pitavastatin, atorvastatin, etc. The function is blocking enzyme necessary for the formation of cholesterol, mainly reduce total cholesterol and low-density lipoprotein cholesterol. Sometimes it can reduce triglycerides to some extent and increase high-density lipoprotein cholesterol to some extent. And it is the first choice for lowering low-density lipoprotein cholesterol. It has some side effects such as gastrointestinal side effect and liver dysfunction, renal dysfunction. Another drug for dyslipidemia treatment is a fibrates, such as fenofibrates. It is the most common drug of fibrates. Its function is to reduce triglyceride and low-density lipoprotein. Sometimes it can increase high-density lipoprotein cholesterol. It is the first choice for hypertriglyceridemia. Side effects has gastrointestinal side effect, liver dysfunction, rash, etc. Other drugs has cholesterol absorption inhibitor such as ezetimibe and bile acid secrets and nicotinic acid. It can increase high-density lipoprotein cholesterol. The side effects of nicotinic acid include GI side effect, flushed face, and blood glucose elevation, liver dysfunction, and omega-3 acid esters. Its function is to reduce triglyceride and increase high-density lipoprotein cholesterol. It has no function on low-density lipoprotein cholesterol and total cholesterol. The side effects of omega-3 acid is gastrointestinal side effect. We also have other drugs such as Arestat, Probucol, etc. And for drug therapy, if the patient is suffering from high level of triglyceride, the first line choice of the drug is the fibrates, and the second line is statins, omega-3 fatty acid reagent, and nicotinic acid. For patients with high level of total cholesterol or low-density lipoprotein cholesterol, statins is the first-line drug for the choice, and ezetimibe is the second-line choice. For mixed dyslipidemia, according to the lab results, we can choose the drugs for the treatment of this patient. And that's all for this lesson. Thank you for listening.